Midday. I'm Maria Shilaos. Allergies have come on with a vengeance early this year. Now, you've probably been sniffling or sneezing yourself, and if not, someone around you has been. It's all a result of the warmer temperatures and the earlier bloom time for many high pollen plants. On Health Matters on Midday, Dr. Richard Ferguson, who is the president of the Black Physicians of Utah, joins me to help provide some much-needed relief to allergy sufferers.
Well, definitely the plants are a little bit confused in our grass, but that means things are blooming sooner. I live up in North Salt Lake on the bench there a little bit, and there's tons of things that are blossoming, but I'm already starting to get the irritation, the itchiness of my contacts. I'm starting to get a runny nose. It's really good temperature right now. People are probably not turning on their AC just yet, but they got the windows open and they're leaving them open all day, not realizing that they're actually going to cause their allergy symptoms to persist throughout the night, even though they're inside, because they like all the cool spring air, but that cool spring air has fine particles in it that get into our mucosal and nasal passageways in our lungs, and it persists our our allergic symptoms. Particularly, we're going to probably focus on discussing allergic rhinitis and conjunctivitis that are the most common forms of presentations of symptoms and conditions associated with seasonal allergies. So I would say in Utah, with spring coming on earlier, we have to think about how are we going to identify and protect ourselves from pollen. So we have to think it's most commonly trees, grass, weed, ragweed pollen, and this often shows up as I was alluding to, sneezing, itchy, watery eyes, runny nose, nasal congestion, throat or nose itching. Unfortunately, some of those symptoms actually overlap early on, not the itching part, but definitely the nasal congestion, runny nose, with measles as well. But I think we already spoke about that. But uh, hopefully your provider and yourself can distinguish between the two. So I think the first step is reducing exposure. We live in a bowl unless we get a storm kind of coming through, and until it warms up enough. We have to remember allergy season is usually kicks in when everything starts to bloom around late April. Now we're dealing with things blooming in mid-March. And usually once you hit June, you get different seasonal allergies because everything that was spring blooming starting to kind of not die off, but everything's blossom, it's gone through its reproductive phase for the plants, and you got your bees that are out. So once all that occurs, once you have, in a way, temperatures that are consistently, once you probably hit 90 or 100 and it's been consistent, you're now into summer. Once you
Mm-hmm.
hit summer, a lot of these go away. But what I tell people is check local pollen counts. So on your phone, there's always a little section there that talks about air quality index, and right near it shows pollen. All right. And it's often the same type of color readings as it goes with air quality index. So there'll be a green, there'll be a yellow, there'll be an orange. And that'll often tell you what you need to prepare for when you're going outside. When I was a kid, I was highly allergic, or not highly allergic, but I was allergic to grass, often fresh cut grass. Being from the DC area, I, as a child, for between like the ages of 5 to, about 12, 13, during the peak sort of allergy season, was strong for about 2 or 3 weeks, right around early May or late April. This is also before they came out with the medications that don't make you sleepy. That's when you only had Benadryl as an option. I would have that, and my mom would put a mask on me. And then I remember often at the end of the day or when we're changing out a mask, it's just covered with pollen on the surface. And so we have to be mindful that if you don't have a mask on, if you're someone that's very reactive, meaning you get very irritated, sneezing, coughing, maybe even inducing an allergic form of asthma, you have to reduce how much you're inhaling. So follow local pollen count, keep windows closed during high pollen periods, okay? I know it's nice out. Keep them closed. Limit outdoor activity when pollen is high. So when people come inside, change your clothes, wash off, even shower, especially if you're someone that's very sensitive, especially before bed. Some people don't realize that you're keeping windows open with a fan circulating, and then you get onto your pillow, you actually can't see it, but you might have pollen on your pillow, and then you'll have difficulty breathing at night. So reduce exposure. Next, for many people, the best first line medication is actually a nasal steroid. That's for everyday use during the season. A lot of people think, and also I also sort of combine that with taking your Zyrtec or your generic Sertrazine, or Zysol is very popular. These sprays reduce the inflammation and help with congestion, the sneezing, and the runny nose. So that's one of the and these are over the counter. You don't need a prescription. So that's your Flonase and its associated generics. Nasal Quart is another form. And then I think the other thing to think about is just try to avoid uh, what I want to say is cold medication. So you want to avoid decongestion. So anything that has like pseudoephedrine, that helps with short term, but it's not right for everyone, especially if you have high blood pressure, maybe you have glaucoma or heart disease. You don't want to use that, and you usually don't want to use it for longer than 3 days. So anything
Mm.
that's saying allergy with a D, I tend to steer more people to just going your normal one that doesn't have a decongesting component. You don't need this pseudoephedrine. That's why I say nasal steroid and then an oral antihistamine that's not Benadryl. If you got Benadryl and that's all you have, that's fine. But just remember your Sertrazine, your Loratadine, your Fexofenadine, that's also called Allegra. Those are far more effective than your diphenhydramine or your Benadryl because it doesn't make you drowsy and you can actually continue working. And the other thing people have to remember, you may have to dose a second time. Many of them say 1 time a day, but really they wear off in about 15, 16 hours. So I often have to dose again before I go to sleep because if I didn't say my wife kept the windows open and didn't close them, I'm actually going to have some increased nasal congestion when I wake up in the morning that I might not have had or itchy eyes. And it's because the effect of the loratadine or the Zyrtec equivalent has worn off. I've been talking a lot, Maria.
So I'm
Is there
wondering
anything?
why avoid a decongestant? I mean, what is the harm there?
Oh, I mean, so it can actually complicate for those that may have heart disease, thyroid disease, diabetes, or urinary problems. It can actually cause a little bit of urinary retention. My point here is if it's a very low dose, it's probably okay. But this is why, and also nasal decongestion. So you got your nasal steroid, but you don't want to use something like an Afrin when you get stuffy, when it's
Mm.
allergies. So once again, try it's just me emphasizing if you don't have allergy medication, cold medication, if you use it, try not to use it for a prolonged period of time. It shouldn't be used for daily, just because it might have a little Benadryl in it. And like I said, pseudoephedrine is it's effective for short term, but it shouldn't be used, I think, for long term. It's been just because it can cause complications if you're someone that has some of those conditions. If you don't have any of those risk factor, those conditions that place you a little bit more at risk for having complication with using it, it's fine. It just dries you out a little bit more.
Is there
And
anything
I was,
new on the horizon? I mean, how do people decide when they should actually be seeking a doctor's attention, not just using the over-the-counter stuff? Is there anything new on the horizon to actually treat
I
allergies?
mean, so I would say it depends on the type of allergy you have. Excuse me, I'm about to sneeze myself. Excuse me, hold on 1 second. Is it coming? No. Okay. So that's probably good for the show. I would say if symptoms are persistent beyond using over-the-counter nasal steroid in a daily one of the newer antihistamines, uh, or keep coming back every year, even though you have over-the-counter treatment and it doesn't seem to control your symptoms, that's when you want to seek care from your primary care doc. You don't necessarily need to go see an allergist unless it's impairing you from doing like daily tasks. You know, your eyes are watering so much that you can't drive, or you can't work, or you're sneezing so much that it's hard for you to sleep, or you're having difficulty breathing, or you get swelling in your face. That's when you need to seek an allergist. And they can put you on something such as immunotherapy. Those are your allergy shots. that have been around a very long time. Often people can get great control with these, but then it's sometimes hard to wean off of them. Eventually, a doctor should be weaning you off of your allergen shots. So these are shots that kind of slowly sensitize you after you're someone that's gone through formal allergy testing. So it's kind of not so much new on the horizon. It's about what type of extrinsic form or type of allergies you have. And if you're someone that needs immunotherapy, or in meaning getting the allergy shots, there's also biologics that can be used, but that's more so if you have a type of allergen-induced difficulty breathing. So if it triggers your asthma in a certain way, but we usually or you have a form of urticaria or just itchy rashes that show up. There are biologic agents that someone can qualify for, but usually you're going to have to fail your general sertrazine, Zyrtec, loratadine first, and go through formal allergy testing before someone will likely get that covered by your insurance. So I would just say the quick take home is treat early, not late. So start before your allergy. Know it's coming. Pay attention to pollen counts. Uh, Wash your face before you go to bed. Take a shower if you can. Change your clothes. The key is to wash this pollen off and use the medications consistently. Like I said, you're not the type 2, I would say, antihistamines that are out now. And for many people, a daisy nasal steroid is often the backbone of treatment.
All right.
It's proven
And
to
then you
be.
have an event coming up to help people who suffer from allergies.
Yes, particularly if it leads to asthma. So there was a close friend of mine and business leader in Utah, but particularly more so for the Black community, named Nikki Walker, and she died of asthma or a few days after Juneteenth last year, and so a memorial to her. And this is something I would like for BPOU to do annually. We're going to have an asthma awareness prevention treatment lecture. We're actually flying in a pulmonologist that has a lot of experience in treating and managing those with asthma. And we're going to have a bit of a panel. So it's going to be a little bit of education. And at the same time, those that are sharing their experiences living with asthma in Utah, because actually a lot of people that relocate to Utah, their asthma worsens, their allergy symptoms worsen. And so this will be on May 16th at Marmalade Library in their big multi-purpose room from 10:30 to 12. So it'll be a very engaging event. You'll learn a lot, and hopefully it'll give you a little bit to take home to better manage your allergy symptoms as well as your asthma.